I'm a fellowship-trained breast surgical oncologist, and recently someone asked me, after completing treatment for breast cancer, are there any standard scans or tests that we need to do for monitoring purposes? I consulted a few guidelines just to double-check my knowledge about this, but the answer is that it should be an individualized approach to the patient depending on what type of breast cancer and what stage it is. For example, for someone who was diagnosed with breast cancer under the age of 50 and underwent a lumpectomy, it's a good idea to add in MRIs as well as mammograms to monitor the breast and make sure the cancer doesn't come back there. For someone with extremely dense breasts, it might also be a good idea to include MRIs in the screening plan going forward. Now, to look at if the cancer has come back somewhere else in the body, we don't recommend routine CT scans or PET scans because they do come with radiation exposure. But this test, the circulating tumor DNA, and this is the picture that I have up on the screen, is a good test to monitor. The circulating tumor DNA looks for pieces of this tumor's DNA floating around in the bloodstream, which can indicate that the cancer is back earlier than any imaging scan can. It needs to be started before the patient gets treatment because there needs to be a special test that's developed in order to identify your tumor's circulating tumor DNA. And then after finishing treatment, it's something that can be done every 3 months, and it should stay negative. If it becomes positive, meaning that there are cancer cells floating around in the bloodstream, then additional imaging like a CT scan or a PET scan can be considered to see where that might be happening. Now, the problem with this test and why it isn't used for everyone is that right now, if we do find out that someone's circulating tumor DNA is positive, we know that the cancer is going to come back, but we don't necessarily know where. And sometimes it can take us almost up to 2 years to figure out where, based on the imaging studies. And in those 22 months or so, patients are just waiting for the inevitable, but there isn't really anything they can do to prevent it from happening. We do have clinical trials going on to see if starting to treat patients even before we see where the cancer might be coming back makes a difference. And in studies performed around colon cancer, starting treatment earlier actually does make a difference in survival or helps patients live longer. So I do think that in the future, more and more medical and surgical oncologists are going to be using circulating tumor DNA routinely to monitor their patients after surgery.